much, Jancy, for the introduction, and thank you to you guys for the invitation. And my name, as you have indicated, I'm Jabu Mtsweni. I lead the National Policy Data Observatory, as well as head the Information and Cybersecurity Center at the CSIR. And in terms of my presentation, I think the work is more aligned to the National Data Policy Observatory, which has been doing a lot of work in supporting various government structures with regards to data analytics, modeling, tracking, and monitoring, particularly with regards to COVID, and now in terms of the vaccination program, and work very closely with the planning, monitoring, and evaluation in terms of checking where we are and if we are on track. And I think the Policy Data Observatory is a capability that came by chance. And this clearly indicates that we need to, in the future, prepare much better for the pandemics because some of these capabilities could be more effective if they are developed long before pandemics arrive, but I will deal with that later on. So what we call the National Policy Data Observatory, supported by DSI, it is an observatory that is incubated at the CSIR, and it does a lot of work in terms of data collection, storage services, analytics, trends, dashboards, and not just on pandemics, but on various socio-economic indicators, complementing what other institutions are doing already. But I think what is also very important is some of the work that we have done, and which is what we'll be talking about. They have informed policy. But as you work on some of this data, you then realize that some of the work that we do, particularly in tracking where the pandemic is at, it could be done better. But also you realize that the work of dealing with pandemics is not just for the Department of Health, but there are a number of stakeholders that are involved, particularly because when the pandemic comes, it also affects other socio-economic sectors, and so on and so forth. And we can clearly see, for example, in this graph, the different waves and its impact it has had on communities, particularly when you look at wave number 1, cases and deaths very, very high. Obviously now when there are vaccination programs, we can see that the impact becomes even lower. But that's not what we are talking about today. And I think when you look at this picture, pandemics have been with us, for ages. When you look at this specific picture, you can clearly see since the 1300s, we have had pandemics that have dealt a blow in societies. But what is maybe of interest to note here is that the more pandemics we have, the more prepared we seem to be for the next ones, or the impact seems to be a little bit less. For example, if you look at the smallpox in the 1500s, it caused a lot of deaths. You look at Spanish flu and so on and so forth. But when you look at the bottom, you can clearly see, my slides, you can clearly see that, for example, even with the COVID-19, this was earlier on in the pandemic. So I think now we have experienced almost 1 million or so above that. And when you look at issues like cholera and the others, and these are not the end. Of course, if you have these pandemics, sometimes it's all about how we are preparing ourselves from the science point of view, from the policy point of view, but also from the capability point of view, because these infectious diseases, they are always predicted one way or the other. The World Economic Forum generally predicts some of these global risks on a yearly basis. This is in 2020. For example, you can clearly see the top risks by likelihood, the top 4, looking at the weather, as well as the infectious diseases. They are always up there most of the time. And we've seen this in some other cases, the infectious diseases, the scale of impact becomes small, maybe concentrated in a particular country, but clearly the data tells us that pandemics, we will continue to come in one shape or the other. The impact But as you can see on the impact side, you can see that the infectious diseases, if, for example, they become like COVID, they can have a huge impact. And I think everyone has experienced that. And I think the first point that I want to start with is more on the issue of how do we then, from the data, because we work with the data, and we can clearly see that when you collect the data at the later stages or when the pandemic is at the door, it becomes very, very difficult to prevent it or to reduce the impact, because you learn as you go. And we have seen even with COVID that many countries were learning how to deal with the pandemic as the cases or the infections were detected in communities and stuff like that. Similar, for example, with the vaccination programs. But from the policy perspective, I like this from McKinsey and Company, where they speak about how do we shift the mindset, particularly in the healthcare systems, so that we can reduce the chance of future pandemics. But over and above just reducing the chance of future pandemics is how do we deal with them better, particularly from the policy and the science point of view. And if you look at this particular slide, you know, we must move away from break a glass in case of emergency, where we have systems that are always on and partnerships that can scale during pandemics. Give a typical example in a South African context. I've given the National Policy Data Observatory is only established when we see that there was no National Policy Data Observatory or a data capability for government where they can use to inform policy on a regular basis. And you look, for example, with the EVDS system, the electronic systems that have been developed, whether it's for vaccination or even the systems that have been developed for tracking and monitoring the pandemics. Those systems were only built once the pandemic was before us, but the policy orientation would now be, let's have systems just like other countries that can always be on, and these systems can scale when they're required to. For example, health surveillance is something that needs to happen on a regular basis, not only when we are dealing with COVID. And this deals with obviously strengthening global, national, and local partnerships in order for us to detect these diseases much faster and so that we can limit the impact. And we have seen this, for example, with the variants of concerns, that diseases, they move from one country to another as people are global, and they also move without us having proper systems in place, particularly to monitor and track these diseases. It becomes very difficult for us to be effective in the detection part, or whether it's in tracking and tracing. And I think based on what we have seen and with the data that there is now available, continuous tracking is very, very important. Of course, before, particularly when you only see some of these diseases happening in countries far away, we think they may never happen in our shores. So we wait sometimes for these outbreaks to happen, but as it is indicated here, we must have an integrated pandemic prevention agenda in our policies, whether it's about improving, health checks, it's about improving access to health care, and so on and so forth, and probably initiatives such as your NHI are trying to address that. But it's very, very key that we have integrated epidemic prevention agenda, including having systems, that are ready to set. We have seen, for example, when COVID came, we were scrambling in our case with healthcare capacity. Sometimes we don't even know how many beds we have because this data is not collected on a regular basis, or we don't verify it on a regular basis. But it's good now, at least we know on a regular basis how many people are in hospital and so on and so forth. Obviously, this needs to extend beyond the pandemic that we have now, because we know that pandemics, they evolve as well. And then, of course, the last point, I think this is very, very key, particularly from the science point of view. And we have seen over the years that there's an underinvestment in R&D, particularly for emerging infectious diseases. COVID showed us that we really need to invest, particularly in ensuring that there is a proper response to pandemic. And we have seen with the CSIR, HSRC, and various other institutions in the country that when they are funded to conduct research, especially quick reaction tasks, they can do it. Now we are able to even track, excess deaths. We are able to track various mortality rates in the country. We are able to understand what makes hospitals full at different times and so on and so forth. And we are even able to understand the health impact against some of the socio-economic indicators, as we have seen with the lockdowns and so on and so forth. And I think, just for me to close, for us to prepare, one of, obviously there's the policy side, as we have spoken about, but the other aspect is more of a capability-driven approach. And we always see, like now with vaccination, you would realize that in Africa or in the low-income countries, we are lagging behind. Most of the time is because of the lack of capability, where sometimes there are no processes and people are not trained, but also maybe we have no technology and data. For us to prepare for future pandemics, we need to have processes in place, whether it's regulations, people must be trained, we must capacitate, we must have the resources, and as well must have what I call the posted fit approach, where even if you have processes, people, and technology, but the support systems are very, very important. There must be equipment, there must be governance. Facilities are very, very key, as we have seen, as well as information, because with information, you can make proper decisions. Ultimately, it's about also leadership and strategy as a country as well. It becomes very, very, very important. And then, of course, the issue of data, because with data, you can inform policies in various ways. And I think we have seen, even within this pandemic, that when the data is not consistent, is not accurate, is not complete, it becomes very difficult to report properly, and sometimes it can also lead to a lot of misinformation, which is what we need to deal with. And then the other aspect is the issue of integrated capability management. There can no longer be silos where, for example, the Department of Health, they work on their own. You need people to come together, particularly if they are to respond effectively to these pandemics. That is why you need technical people, you need social people. Hence, when we talk about the skills that are required, we also need to look at the socio-technical systems, because it's not only about technology or data, but it's about a combination, and we have to be collaborative as well. So when we are building the skills, as much as I'm data science focused, but we need to think over and above just that, because ultimately when the data is there, but it does not serve the decision makers, it might not necessarily be useful. The other important aspect, as I'm about to wrap up in the next 2 minutes, is that when we are dealing with pandemics, we have also realized that soft skills become even more important. Particularly, we see the fear that the people may have, the trauma. So we need to have that solidarity. We need to have the compassion. And this may sound very obvious, but when you look at social media, when we're dealing with these pandemics, you really realize that there's a lot of requirement to build some of these skills so that as a country or as the world, we can respond effectively to some of these pandemics. And then from the research point of view, obviously, it's also very important for us as a science community to continue with innovations, research, and various interventions, not only when these pandemics are at the door, but from the investment point of view, including tracking, monitoring, modeling, especially when it comes to proactive and real-time surveillance at different levels, because collecting this data helps us to also inform policy, having health information systems that are ready, including healthcare modeling, particularly on the burden diseases, whether it's HIV and various others. And then I cannot emphasize more on building capacity, because we can have the technology, we can have the data, but if people are not capacitated, it becomes a little bit tricky. And then the last slide is more, obviously, we are in the digital transformation era. So it also becomes very, very pertinent that as we prepare for pandemics, we also embrace technology, because we have seen how it has assisted us to actually respond to the pandemic in a more faster way. And technology makes us to be global. We can get information much quicker, but we can also use technology to even track some of these diseases much quicker if you look at Internet of Things and so on and so forth. In conclusion, it's obviously very important, and we have seen it even in our country, where now we have the national state of disaster regulations, that they have their limitations, right? In terms of how far can they go in terms of mitigating the pandemic. And that is why it's very important for us to learn the lessons and update some of these policies or laws and our plans. But sometimes it does not help if we have the plans, but we don't exercise them, or we don't simulate, or we don't test them on a regular basis. Where we, just like I always say to people at work, when there's the fire, we always test whether our fire sprinkler systems are working, and we need to do the same even with the systems that we put in place to respond to these pandemics. Obviously, I've spoken about continuous monitoring, checking where the diseases are in different countries, whether they are coming into a country. It's very, very important, identifying the various threat and risk. I think the issue of training people, I've spoken about it a lot, including R&D, but we also need to know our assets, know how many hospitals we have, what resources do we have, whether it's gas and so on and so forth. Many information systems can do this. We just need to put them in place. And as a parting shot, it's all about collaboration and coordination. No one discipline can work alone, especially when we want to prepare for these future pandemics. It's about collaborating, working together, and ensuring that we deal with the future pandemics in a productive manner. Thank you, Chair. That's where I will end.